We'll start now, though. Welcome and thanks for being here for our Thanksgiving feast. Uh, this is our product demo live. I'm your host, Michael DiDomenico, publisher of Sleep World Magazine. Thank you for joining us on a Friday afternoon. A beautiful day here in Philly. It is 44 degrees and clear, and this is the third installment of our Fun Friday format, where leading companies present their latest products and services. Today, we have three companies. First up is Nonin. They're going to demo the Nonin Health Platform, a cloud-based overnight oximetry testing solution, and how it's helping HMEs and DMEs and sleep clinics increase their efficiency in their overnight oximetry programs by reducing manual uploads and speeding up time to treat. So let's get this Thanksgiving show on the road. We're going to bring up Rashad Buckner. Rashad is a seasoned marketing executive, 20 years of experience in building insights, delivering growth strategies, and executing programs through the best. Hang on one second here. Sorry about that. Best in class marketing within the healthcare field. Rashad has held various sales and marketing leadership positions, serving various patients with chronic diseases, cardiovascular, diabetes, respiratory, and sleep. Rashad is passionate about understanding how sleep impacts various disease states and how the total health of a patient is impacted by the lack of addressing underlying sleep related issues. Rashad, thanks for being here.
Thank you. I'm glad to be here, Michael, and I love the festive hat. So thank you.
Thank you. I'm going to leave it to you. I'm going to take the hat off because it's hot with this thing on. So I'm going to bug out of here, and I'll leave it to you.
Sounds good. All right. I'm going to bring up on the screen here. Hopefully everyone can see my screen. So again, I'm very excited to be here with you all to talk a little bit how Nonin is really helping us all rethink how overnight oximetry care is delivered in the US today. All right, so I'm going to go to the next screen here, see if I can do it right. All right, perfect. All right, so as we think about the challenges, I think most people are probably familiar with these, but I'm going to walk you through a few of them. So first, I think providers must endure really complex workflows, from shipping to manual uploads and other administratively burdensome tasks related to overnight oximetry. Those same providers, when I've had chances to have talks with them, have told me it takes anywhere from 7 to 20 days from testing to the treatment decisions, which really delays care. And that's not what we want to see in the system. Providers are dealing with the complexity of really sharing data with multiple different stakeholders. And finally, there's just a lack of reimbursement for these providers to really do and complete the diagnostic testing, which provides necessary insights into the right treatment decision. So all in all, the workflow just simply doesn't work for patients and providers today. So now, luckily I'm here to talk about how no longer do we have to deal with these pain points without a clear solution. And I'm really excited to say that we've introduced Nonin Health, which is a cloud-based patient management system. So there's 4 main components I'm going to walk you through throughout the presentation today. First, there's a smartphone app that's a patient-facing app that's easy to download and makes for easy test administration. Second, the patients will wear a very simple wrist-worn oximeter on the wrist to conduct the overnight oximetry testing. This works on a wide range of conditions, such as in motion and low perfusion. Third, providers are then have remote access to the patient's testing data through the cloud to verify the testing results. So there's no more waiting until you get the device back before you know if you have a test is conclusive or inconclusive. And we also recognize that not all patients have a smartphone. Some live in remote areas where that access to data is a little bit more difficult. Well, we do have a desktop applications for providers to be able to get that data, that testing data that they need. And finally, the fourth thing is that providers are able to easily have this data transmitted into an independent diagnostic testing facility through a seamless API transmission. So this is truly meant to be a comprehensive solution that is meant to be for all, and there's nothing like in the market today. All right, so I'm going to take you through the first one, I promise. So the patient app experience. It's really simple. The patients will download an app to their phone, and after a quick setup, all they have to do is click on the Get Started button at the bottom of the screen there. On the next screen, you'll see it takes you to 2 simple instructions. First, it's strapping the wrist onto your, or strapping the device onto your wrist. And next is to place your index finger right into the soft sensor. And then that's it. Away you go. You're starting the test. You click on device and you start to administer the test. Now, we also recognize that if you're visual like me, you need some sort of visual cue. And so what you'll see there is the time is starting to tick up, and you'll see that counter clicking up in a green circle. And that's really indicating that the test is going. Now, if you're also like me in the middle of the night, you're going to probably need to use the restroom. So the way to simply pause the test is you just remove your finger from the sensor and the test is paused. Once you're done, you come back and you're ready to start the test again. Simply put your finger back into the sensor and away you go. Now, once that testing is complete, you'll see on that last sort of screenshot there, you'll see a green check mark and you'll see it says test complete. Now, in some situations, we recognize that providers may need, you may need patients to do multi-night testing. You simply just go ahead, start the next test over by clicking repeat test and away you go. So we try to make this as simple as possible for the patients to give them the instructions in order to complete the test. All right, now I mentioned there's going to be a second component of this, which is the remote access to the web portal. Now, you can take a look at the test report here that the providers get to see as part of the Nonin Health portal. Now, I know on the screen it's kind of hard to see, but I can promise you it's consolidated to one report with all the necessary desaturation level information. So let's talk about a few things that are in this report. So first, we include the time. So the time less than 90% SpO2, equal to 89%, and less than 88%, which is a necessary requirement for oxygen qualification. Second is includes all the desaturation events at 3% and 4% at the different guidelines there, as you can see, AASM and CMS guidelines. Third, we really built this platform so we can indicate all the important desaturation events, specifically talking to our dental sleep providers that really needed it for education. We believe that same application can be used for all patients. And then finally, we have this graphical SpO2 and pulse rate data information along with the events displayed right there on the report. And finally, maybe the most important thing that always gets overlooked is you can easily send this information to the independent diagnostic testing facility with a click of a button. Overall, the Nonin Health testing report was built by Nonin, but it was heavily influenced by our physician needs. All right, so I mentioned that they also talk a little bit about what we're doing, how we got here. Well, we built this program. Frankly, we were just set out for the pre-screening. But as we dug in a little bit further, it was clear we could influence many places across the care continuum. So as we started looking at the versatility with our software solution, along with the device combination, we worked with providers, we tested with patients, and we learned that therapy implementation, such as PAP and oral appliance titration, is one area that we can help aid in that process. Another area is if the patients don't necessarily feel good, which is really about the therapy effectiveness, how is that working? Well, if the patients aren't feeling better, we need to examine that therapy effectiveness, and our device can help it within that process. So all in all, really, Nonin Health is a versatile solution developed in patient care with them in mind. Okay, so I've said a lot. I could probably talk all day long on this, but let's use a real life example with one of our providers that are in our trial. So this is a regional provider, pretty decent sized DME provider that was challenged with various shipping delays that were just frankly too costly. Then they had to deal with manual uploads, time that took away from doing other more important tasks, and then device data that failed, but they didn't know if it failed until they got the device back. And that's a big problem. And so then what would happen is patients would be frustrated, the physicians would be frustrated, DME provider would be frustrated because they'd have to send the device back, and then the patient would have to spend another night of doing testing. And then finally, they dealt with a lot of losses in the devices. Now, this is something that's very important, as a lot of devices simply never made it back. They were just out there, checked out in the field, and ultimately never seen again. All right, so as we went through this process, we understood their needs. We worked with them and we said, well, let's take a look at what happened. So as a result, they saved roughly about 1 week time saved in turnaround time, which directly aids in that device throughput and ultimately that patient care. They achieved savings about $30 per patient by taking removed costs out of the system. Then they saw fewer devices lost because of the improved tracking of the devices in the field. Finally, as we think about their qualifying testing with IDTFs or independent diagnostic testing facilities, we're expecting to see even greater results as time goes on. I think this quote at the bottom really sums it up as they stated, we shorten the time it takes to get test results, which means oxygen setups happen faster and so do physician decisions. I think that really is the point and says it all. All right, so I'm going to go ahead and take us home and get to some of the key takeaways. So, Nonin Health is working as designed, and I'm proud to say that. Faster time to therapy means faster time to the patients just feeling better, which is really what good healthcare is all about. Now, I doubt anybody on this call went into healthcare saying, oh, I really love dealing with logistics. So let us ease the burden there as we will really focus on reducing that logistical burden. Then finally, better patient, better staff experience is vital. Providers have a difficult enough time as it is without the added stress of dealing with and navigating these very complex systems. So you saw earlier, we kept it really simple. Keep it simple. Simple's better. So at Nonin, we see a world where every patient has access to the right therapy faster, with less burden to the providers, and ultimately getting that data that truly then gives them the better outcomes in the picture that they're looking for. That's the future we're building. And we're building this future by listening. That's how we came up with this product. We listen to our partners, listen to our clinicians, most importantly, our patients. That's how we'll continue to enhance the therapy and the technology, and that's going to create real value across the care continuum. And I say, finally, I'll get to the quick plug, right? If you're really interested into understanding this simple solution and how it can help, we want to hear from you. So please reach out, schedule a demo with us at nonin.com/nonin-health. And again, we can transform how respiratory and sleep diagnostic care is delivered in the system today. So with that, I think I really appreciate the time today. Again, love the hat, Michael, and I love to stay for the rest of the program. And thank you all for listening today.
Well, we'd love to have you. And anyone who's not here is, I had said in the e-blast in a social post today, is a total turkey. So let's take down your presentation. There we go. Thanks for that. We got some questions here.
Yeah.
What differentiates Nonin Health from the other overnight testing platforms?
Great question. I think first and foremost, our company was built on accuracy. So we focus there. Well, we want to make sure that the accuracy is key because that's what we believe is going to get patients onto the optimal therapy that they need. Also, just faster turnaround times. We looked at trying to compete with those like Virtuox and others that are out there in the market. And we said, how do we make sure our solution gets the results to customer patients faster, providers faster? And that's through our platform. It's really meant to just sit right on the patient or the provider's computer, easy to access, right there at their fingertips so they can see it near real time. And I think finally, we think of our device as it's reusable. I know there's some advantages for disposable, but reusable is just as strong, especially when those multi-night testing is involved. We know many clinicians need to do that. We want to have a testing solution that's pretty simple. You can do that allows for that. And we really think it makes sense for those customers and those patients that really value that. So ultimately, we think that's what really sets us apart from the competition.
Is it HIPAA compliant?
It is. Thank you for asking that question. So it is. The data is stored through an encrypted cloud-based platform, which is what we developed with our partner here, ensuring full compliance. We took that as the first step in this because we know that's a big barrier. We started there and we built the solution from that point.
I just want to remind everyone to put your questions in the Q&A on the stage and not the event area. Another question for you. What are the key clinical applications that Nonin Health is designed for?
Yeah, great question. So today we're focusing on overnight oximetry as a way to qualify for oxygen. What we're working on is actually getting into a full diagnostic sleep solution. That's to come. We want to make sure we do it right. So we're really spending time with our key opinion leaders and others to kind of make sure that our algorithm and everything we build around that makes the most sense. But that's where we think it's going. We understand that's where the market's going. And so that's where probably what's next in the evolution of our platform.
Nice. Very nice. Great presentation. Concise is what we're shooting for when we do these. I don't think there's any other questions.
I think I see one that says about the HICPICS code, which is a great question. I don't have those, but we actually do have a resource on our site, which we are working with people. Maybe I'm seeing in the chat on the other.
Yeah, you are seeing in the chat.
There you go. So yes, Jonelle, I see you asked that question. We actually do have on our site some resources that go into some of that detail. And so if you reach out to us, we can help provide the necessary, as much as we can give that advice on reimbursement, but we do have the HICPIC codes ready for folks so they can take a look at that and see what they would be appropriate for billing.
Awesome. Yeah, I see it in chat here. Okay. Any other questions in the Q&A area? Let's see. Oh, do they rule out sleep disordered breathing, or is it just oximetry?
Today, it's just oximetry. Correct. Yep. We'll get there at some point, but we wanted to start somewhere, see how it built upon that. Great question.
Good. All right, Rashad, thanks.